Hello everyone, I'm Dr. Angelina Dcosta, and today I want to talk to you about a very important but often overlooked subject, erectile dysfunction in elderly men. Now, I know this topic can sometimes feel uncomfortable to discuss, but let me assure you, it is not only common, it's also manageable. In fact, many men over the age of 60 and 70 quietly struggle with it, thinking it's simply a normal part of aging. But the truth is, erectile dysfunction is usually a sign of something deeper, like poor blood circulation, vitamin deficiencies, stress, or even hormone imbalance. The good news is that nature gives us powerful tools to help. And one of the safest and most effective ways to support sexual health is by paying attention to the vitamins and nutrients your body needs. These vitamins don't just improve sexual function, they strengthen the heart, enhance blood flow, balance hormones, and boost overall energy levels. That means when we address erectile dysfunction naturally, we're also improving total body health. In this video, I will guide you through 8 specific vitamins that can help reverse erectile dysfunction naturally. I'll explain how they work in the body, why elderly men are often deficient in them, and most importantly, how you can include them safely in your daily routine through food and supplements. Remember, this isn't about quick fixes or miracle cures. It's about giving your body the nutrients it needs to heal and perform the way it was designed to. And with the right approach, many men are able to see improvements, not only in their sexual health, but also in their energy, confidence, and quality of life. So, if you or someone you care about has been facing this challenge, I encourage you to stay with me till the end of this video. Together, we'll explore natural, science-based solutions that can truly make a difference. Let's get started. Number 1. Vitamin D, the sunshine vitamin for reversing erectile dysfunction naturally. Erectile dysfunction is one of the most common challenges men face as they age. Many seniors believe it's simply an unavoidable part of growing older, but research shows that isn't always true. In fact, in many cases, erectile dysfunction is linked to something very simple and correctable, a deficiency in vitamin D. Vitamin D, often called the sunshine vitamin, plays a much bigger role in men's health than most people realize. It's not just about strong bones or immunity. Vitamin D has a direct connection with blood flow, testosterone levels, and the health of the blood vessels that supply oxygen and nutrients to the body, including those needed for sexual performance. Why vitamin D matters for erectile health. As men age, the body's natural ability to produce vitamin D decreases. Seniors also spend less time in the sun, which is the main source of this vitamin. Low levels of vitamin D can lead to poor circulation, lower testosterone, increased stress, and even a higher risk of conditions like diabetes and heart disease, all of which are closely linked with erectile dysfunction. When vitamin D levels are too low, the body struggles to produce nitric oxide, a natural chemical that relaxes blood vessels and allows proper circulation. Without healthy circulation, achieving and maintaining an erection becomes difficult. That's why studies consistently show a strong link between vitamin D deficiency and higher rates of erectile dysfunction in older men. How elderly men can get enough vitamin D. The best way to restore vitamin D levels is a combination of safe sun exposure, foods, and supplementation when needed. Sunlight. Spending just 15 to 20 minutes, a few times a week in direct sunlight, helps the body produce natural vitamin D. Foods. Seniors should include foods rich in vitamin D such as fatty fish, salmon, sardines, mackerel, fortified dairy products, egg yolks, and mushrooms. Supplements. For elderly men who don't get enough sun or food-based vitamin D, a daily supplement may be necessary. However, it's important to check levels with a doctor before starting supplementation. Get your levels tested. A simple blood test can reveal if you are deficient in vitamin D. Be consistent. Unlike medication, vitamin D takes time to build up in the body. Regular intake is key. Light exercise, balanced diet, and proper hydration work hand in hand with vitamin D to improve circulation and vitality. Consult your doctor. If you are already on medication for blood pressure, diabetes, or heart disease, always check before adding new supplements. Vitamin D is more than just a vitamin, it is a foundation of male vitality. For elderly men, restoring vitamin D levels can improve mood, strengthen immunity, balance testosterone, and most importantly, help reverse erectile dysfunction naturally. By nourishing the body with this essential nutrient, seniors can experience renewed energy, improved circulation, and greater confidence in their health and relationships. Number 2. Vitamin B12, restoring energy and nerve health to reverse erectile dysfunction naturally. Erectile dysfunction is not always just about aging, it is often connected to what's happening deep inside the body, particularly with the nerves and blood supply that control sexual function. One of the most overlooked nutrients that plays a vital role here is vitamin B12. Vitamin B12 is essential for producing healthy red blood cells, maintaining strong nerve function, and supporting DNA repair. Without enough B12, the body struggles with fatigue, weakness, poor circulation, and nerve damage, all of which can directly contribute to erectile dysfunction in elderly men. Why vitamin B12 is important for erectile health. As men age, vitamin B12 absorption naturally declines. This is because stomach acid levels decrease, and the body finds it harder to absorb nutrients from food. On top of that, many seniors take medications for acid reflux, diabetes, or high blood pressure that further reduce B12 absorption. When the body lacks vitamin B12, nerves don't communicate properly, energy levels drop, and blood flow becomes less efficient. For sexual performance, this means weaker erections, less sensitivity, and a reduced ability to maintain stamina. Studies have shown that low vitamin B12 is strongly associated with higher rates of erectile dysfunction, especially in elderly men. Best sources of vitamin B12 for seniors. The human body cannot produce vitamin B12 on its own, it must come from diet or supplements. Elderly men should focus on foods rich in this vital nutrient. Animal-based foods, beef, chicken, liver, fish, salmon, tuna, trout, sardines, eggs, and dairy products are the richest natural sources. Fortified foods, some plant-based products, like fortified cereals, soy milk, and nutritional yeast also provide B12, making them useful for vegetarians. Supplements. For men with absorption issues, B12 supplements in tablet, sublingual under the tongue, or injection form, may be recommended by doctors. Special advice for elderly men. Check for deficiency. Symptoms of low B12 include tingling in the hands and feet, memory problems, fatigue, and difficulty maintaining balance. These signs should not be ignored. Don't rely only on diet. Since absorption decreases with age, even eating enough B12-rich foods may not be sufficient. Seniors may need supplementation. Pair with other vitamins. B12 works hand in hand with folate, vitamin B9 to improve blood flow, and nitric oxide production, which are essential for strong erections. Elderly men should have their B12 levels checked during routine health exams, especially if they feel weak or fatigued. Vitamin B12 is often called the energy vitamin, but for elderly men, it is also a vital sexual health vitamin. By restoring healthy nerve function, boosting red blood cell production, and improving blood circulation, vitamin B12 can play a direct role in reversing erectile dysfunction naturally. For seniors struggling with low energy, poor circulation, or nerve-related issues, paying attention to B12 levels may be the missing key to renewed vitality, stronger performance, and better overall confidence. Alongside a healthy diet, regular activity, and medical guidance, vitamin B12 is a powerful tool to restore not only sexual health, but also total well-being. Number 3. Vitamin C, the circulation booster, for reversing erectile dysfunction naturally. Erectile dysfunction in elderly men is often linked to one key problem: poor circulation. Without proper blood flow, the body struggles to deliver oxygen and nutrients to vital organs, including those needed for sexual performance. One powerful nutrient that can naturally improve this situation is vitamin C. Vitamin C, also known as ascorbic acid, is widely recognized for boosting the immune system and protecting against colds. But what many people don't realize is that vitamin C plays a crucial role in vascular health, blood vessel strength, and nitric oxide production, all of which are essential for achieving and maintaining healthy erections. Why vitamin C matters for erectile health. Erectile function depends on the ability of blood vessels to relax and expand, a process driven by nitric oxide. Vitamin C enhances the body's ability to produce and preserve nitric oxide, which means better circulation and stronger blood flow to the reproductive organs. For elderly men, this is especially important because aging often brings stiffened arteries, higher oxidative stress, and weakened blood vessels. Without protection, these issues can severely limit blood flow and increase the risk of erectile dysfunction. Vitamin C works as a powerful antioxidant, reducing free radical damage, strengthening blood vessel walls, and helping restore healthy circulation. Best sources of vitamin C for seniors. The body cannot produce or store vitamin C on its own, which means elderly men must get it regularly through diet or supplements. Some of the best natural sources include citrus fruits, oranges, lemons, grapefruits, and limes. Berries, strawberries, blueberries, blackberries. Tropical fruits, kiwi, papaya, pineapple, guava. Vegetables, bell peppers, broccoli, spinach, kale, tomatoes, and Brussels sprouts. Supplements, for men who don't get enough vitamin C through diet, a daily supplement may be beneficial. Special advice for elderly men. Unlike some vitamins, vitamin C leaves the body quickly, so it must be consumed every day. Combine with vitamin E, these two vitamins work together to protect blood vessels and reduce oxidative stress, further supporting erectile health. Support collagen production. Vitamin C also helps the body make collagen, which strengthens blood vessel walls and improves elasticity. Limit alcohol and smoking. Both habits reduce vitamin C levels in the body, making it harder to maintain proper circulation. Check digestion. Seniors with digestive issues may absorb vitamin C less effectively, making supplementation even more important. Vitamin C is far more than just an immunity booster, it's a circulation booster and a natural protector of vascular health. For elderly men, keeping vitamin C levels high can reduce oxidative stress, support healthy blood flow, and directly improve erectile function. When combined with a diet rich in fruits and vegetables, regular physical activity, and other essential nutrients, vitamin C can help seniors not only fight erectile dysfunction naturally, but also improve their overall vitality, energy, and quality of life. Number 4. Vitamin E, the antioxidant protector, for reversing erectile dysfunction naturally. Erectile dysfunction is often thought of as only a circulation problem, but in reality, it's a combination of oxidative stress, poor blood vessel health, and low energy levels. One vitamin that directly supports all of these functions is vitamin E, a powerful antioxidant known for protecting the body's cells, strengthening blood flow, and supporting male reproductive health. Vitamin E has long been associated with vitality and fertility, but recent studies show it plays a significant role in reducing erectile dysfunction, especially in elderly men. By protecting blood vessels from oxidative damage and improving circulation, vitamin E helps ensure that enough oxygen and nutrients reach the tissues necessary for healthy sexual function. Why vitamin E matters for erectile health. As men age, free radical damage increases in the body. These unstable molecules weaken blood vessels, stiffen arteries, and reduce nitric oxide availability. The result is poor blood circulation, which is one of the primary causes of erectile dysfunction. Vitamin E acts as a shield against oxidative stress, protecting blood vessels from damage and keeping them flexible. Flexible, healthy blood vessels are essential for proper blood flow, and proper blood flow is the foundation of sexual performance. In addition, vitamin E has been shown to improve testosterone levels, support sperm health, and reduce inflammation in the body, all of which contribute to better energy, confidence, and overall vitality for elderly men. Best sources of vitamin E for seniors. The human body cannot produce vitamin E on its own, so it must come from diet or supplements. Seniors should include these vitamin E-rich foods in their daily meals. Nuts and seeds, almonds, sunflower seeds, hazelnuts, peanuts. Oils: sunflower oil, wheat germ oil, olive oil. Green vegetables: spinach, broccoli, kale, and Swiss chard. Avocados: a heart-healthy fruit, rich in both vitamin E and healthy fats. Supplements: elderly men, with absorption issues or very low dietary intake, may benefit from vitamin E capsules, but always under medical guidance. Special advice for elderly men: don't overdo supplements. Too much vitamin E in supplement form can cause side effects. Focus on food sources first. Choose natural sources. Natural vitamin E, D-alpha tocopherol, is better absorbed than synthetic forms, often found in cheaper supplements. Combine with healthy lifestyle. Regular walking, quitting smoking, and a balanced diet enhance vitamin E's protective effects. Vitamin E is more than just an antioxidant, it is a protector of male vitality. For elderly men, it helps keep blood vessels strong, improves circulation, balances hormones, and reduces oxidative damage that contributes to erectile dysfunction. By including vitamin E-rich foods in the daily diet, and supplementing wisely when needed, seniors can experience improved energy, stronger erections, and better overall health. When paired with other essential vitamins, and a healthy lifestyle, vitamin E is a natural ally in reversing erectile dysfunction and restoring confidence. Number 5. Vitamin B3 Niacin, the blood flow vitamin, for reversing erectile dysfunction naturally. Erectile dysfunction, in elderly men, is often closely tied to poor blood circulation, and high cholesterol levels. When the arteries are stiff or clogged, the body struggles to deliver enough blood to vital organs, including the reproductive system. One vitamin that directly addresses this problem is vitamin B3, also known as niacin. Vitamin B3 is essential for converting food into energy, reducing harmful cholesterol, and improving blood vessel function. Recent studies have also shown that niacin can improve erectile function by enhancing circulation and supporting the release of nitric oxide, the natural compound that relaxes blood vessels and allows for stronger, longer-lasting erections. Why vitamin B3 matters for erectile health. Many elderly men suffer from high cholesterol, diabetes, or cardiovascular disease, all of which contribute to erectile dysfunction. Vitamin B3 plays a key role in improving lipid balance by reducing bad LDL cholesterol and raising good HDL cholesterol. By protecting the arteries and improving circulation, niacin helps restore the natural blood flow required for sexual performance. Additionally, niacin has been shown to improve endothelial function, which means it helps the lining of blood vessels relax properly. This is critical for erections, since stiff or narrow vessels are one of the main obstacles elderly men face. With improved circulation, oxygen and nutrients reach the tissues more effectively, leading to better energy and stronger erections. Best sources of vitamin B3 for seniors. Vitamin B3 can be found in a wide range of everyday foods, making it easy for elderly men to include in their diet. Poultry, chicken and turkey. Fish, tuna, salmon, mackerel. Lean meats, beef and pork. Legumes, peanuts, beans, lentils. Whole grains, brown rice, oats, barley. Fortified foods, some breads and cereals are enriched with niacin. For men who cannot meet their needs through diet alone, supplements may be an option, but only under medical supervision. Special advice for elderly men. Check cholesterol levels. If you have high cholesterol or cardiovascular issues, niacin may be especially helpful, but always consult your doctor first. Start with food sources. Whole foods provide not only niacin, but also additional nutrients that work together for better health. Be cautious with supplements. High-dose niacin supplements can cause flushing, headaches, or liver strain. Only take prescribed doses. Support with lifestyle. Regular physical activity, a balanced diet, and stress management will make niacin more effective. Combine with other vitamins. Niacin works best when the body also has adequate levels of vitamin B12 and folate, which support circulation and nerve health. Vitamin B3, niacin is often called the blood flow vitamin, and for good reason. By improving circulation, reducing cholesterol, and enhancing nitric oxide production, it plays a powerful role in reversing erectile dysfunction naturally. For elderly men, adding niacin-rich foods to daily meals and using supplements when guided by a doctor can lead to stronger erections, better cardiovascular health, and improved overall vitality. Alongside other essential vitamins and healthy habits, niacin is a key ally in restoring both confidence and quality of life. Number 6. Vitamin B9, folate, the nitric oxide booster, for reversing erectile dysfunction naturally. Erectile dysfunction is often caused by poor circulation and reduced nitric oxide activity in the body. Without enough nitric oxide, blood vessels cannot relax and expand properly, making it difficult to achieve or maintain an erection. One vitamin that plays a critical role in this process is vitamin B9, commonly known as folate or folic acid. Folate is essential for cell growth, red blood cell formation, and the production of nitric oxide. By supporting these key functions, folate helps improve blood flow, reduce inflammation, and enhance overall cardiovascular health, all of which are crucial for elderly men struggling with erectile dysfunction. Why vitamin B9 matters for erectile health. Low folate levels are surprisingly common among elderly men due to age-related absorption issues, digestive problems, or poor diet. A folate deficiency can lead to anemia, poor circulation, and nerve problems, all of which directly impact sexual health. Research shows that men with erectile dysfunction often have lower folate levels compared to men without ED. This deficiency reduces the body's ability to produce nitric oxide, leading to restricted blood flow and weaker erections. By restoring folate levels, seniors can support healthy circulation, improve vascular function, and enhance their body's natural ability to respond to sexual stimulation. Best sources of vitamin B9 for seniors. Folate can be obtained through a variety of natural foods as well as fortified products. Elderly men should aim to include these in their daily meals: leafy greens, spinach, kale, Swiss chard, and romaine lettuce. Legumes, lentils, chickpeas, black beans, and kidney beans. Fruits, oranges, bananas, papaya, and avocados. Whole grains, brown rice, oats, and fortified cereals. Liver, a rich but less common source of folate. Supplements are also widely available, often labeled as folic acid. These may be especially helpful for men who struggle to absorb enough folate from food alone. Special advice for elderly men. Get tested for deficiency. A simple blood test can reveal if your folate levels are too low. Pair with vitamin B12. Folate works best when combined with vitamin B12, since both support red blood cell formation and circulation. Eat fresh, not overcooked. Folate is sensitive to heat and can be destroyed by long cooking. Steaming or lightly cooking vegetables preserves more of this vitamin. Smoking and excessive alcohol consumption reduce folate levels in the body. Quitting these habits can make a big difference. Consult your doctor. Folate supplements may interact with certain medications, such as those for epilepsy or blood thinning. Vitamin B9, folate is not just important for overall health, it is a key nutrient for sexual vitality. By boosting nitric oxide production, supporting red blood cell formation, and improving circulation, folate can help elderly men overcome erectile dysfunction naturally. Adding folate-rich foods to your diet, combining it with other essential vitamins, and living a heart-healthy lifestyle can lead to stronger erections, improved stamina, and a renewed sense of confidence. For seniors looking to restore their energy and intimacy, folate is a vital part of the solution. Number 7. Vitamin A, supporting natural recovery from erectile dysfunction in the elderly. When it comes to men's health, particularly in the later years of life, few topics are as important yet as overlooked as erectile health. While many focus only on circulation or hormones, there is another key nutrient that plays a quiet but powerful role in sexual wellness: vitamin A. Often recognized for its importance in vision and immunity, vitamin A also contributes to reproductive health, hormone balance, and the body's ability to maintain healthy tissues. For elderly men struggling with erectile dysfunction, this vitamin may serve as a supportive nutrient in the journey to restore natural vitality. Why vitamin A matters for erectile health. Erectile function is not just about blood flow, it also depends on the body's ability to produce healthy sperm, regulate testosterone levels, and maintain the structural integrity of tissues in the reproductive system. Vitamin A is involved in all three of these processes. It helps regulate the production of sex hormones, supports the health of mucous membranes and epithelial tissues, and contributes to overall cell repair. A lack of vitamin A has been linked with reduced fertility, lower testosterone activity, and impaired sperm production, factors that can worsen erectile dysfunction in elderly men. By ensuring adequate vitamin A intake, seniors can support not just their eyesight and immunity but also their reproductive and sexual health. How vitamin A supports sexual wellness in the elderly. Hormone regulation. Vitamin A influences how the body uses cholesterol to produce testosterone. Low levels can mean lower testosterone, which often contributes to erectile dysfunction. Improved reproductive tissue health. It helps maintain the integrity of tissues in the male reproductive tract, reducing inflammation and supporting normal function. Sperm quality. Vitamin A plays a role in spermatogenesis, the production of sperm, which indirectly supports sexual vitality and performance. Immune protection. Chronic inflammation and infections can worsen erectile dysfunction. Vitamin A's role in immunity helps keep the body resilient. Natural food sources of vitamin A. For elderly men, it's always best to aim for whole food sources before turning to supplements. Some excellent options include carrots, sweet potatoes, and pumpkin, rich in beta-carotene, which the body converts into vitamin A. Dark leafy greens like spinach and kale. Liver and fish oils, which are rich in preformed vitamin A retinol. Eggs and dairy products, which provide moderate amounts. By adding a variety of these foods into daily meals, seniors can naturally increase vitamin A levels, while also benefiting from other essential nutrients that support heart and vascular health. Practical advice for seniors. It's important to note that vitamin A is a fat-soluble vitamin, which means the body stores it in the liver. While deficiency is harmful, excessive intake from supplements can also be toxic, especially in the elderly. That's why it's always recommended to consult a doctor before beginning supplementation. A diet rich in colorful vegetables, combined with small amounts of animal-based sources, usually provides enough for most people. For men managing erectile dysfunction, focusing on overall health, staying active, reducing stress, improving diet, and supporting nutrient intake creates the foundation for recovery. Vitamin A is just one piece of the puzzle, but a valuable one. Vitamin A may not be the first nutrient that comes to mind when thinking about erectile dysfunction, but its role in hormone regulation, reproductive tissue health, and immune support makes it essential. For elderly men, adding vitamin A-rich foods to their diet can provide natural support for reversing erectile dysfunction and restoring confidence, energy, and vitality. Number 8. Vitamin K, vitamin that helps reverse erectile dysfunction naturally. When we talk about vitamins and men's health, vitamin K often doesn't get the spotlight it deserves. Most people know it for its role in blood clotting, but very few realize how deeply it affects circulation, blood vessel health, and ultimately sexual performance, especially in elderly men who may already be facing vascular problems. Erectile dysfunction is largely a blood flow issue, and vitamin K directly supports the very foundation of healthy circulation. For older men seeking natural ways to restore intimacy, this vitamin is a quiet but powerful ally. How vitamin K supports erectile health. Erectile function depends on proper blood flow to the penile tissue. With age, calcium can build up in the arteries, making them stiff and narrow. This condition, called vascular calcification, restricts circulation and reduces the ability of blood to reach where it's needed most during arousal. Vitamin K helps regulate calcium in the body by activating proteins that guide calcium into the bones, where it belongs, and away from the arteries, where it causes harm. By preventing arterial stiffening and promoting more flexible blood vessels, vitamin K improves circulation throughout the body, including the pelvic region. This natural support to blood vessel health is one of the reasons researchers have linked vitamin K intake with reduced risks of heart disease, a condition closely tied to erectile dysfunction. Simply put, healthier arteries mean healthier erections. Vitamin K also plays a role in maintaining testosterone production and bone health. Strong bones, especially in the pelvic region, provide structural support, while balanced hormones sustain sexual desire and performance. Many elderly men experience gradual testosterone decline, and while vitamin K is not a miracle cure, it supports hormonal balance in subtle yet meaningful ways. Additionally, vitamin K has anti-inflammatory properties. Chronic inflammation is another hidden factor in erectile dysfunction, as it weakens blood vessels and impairs nerve sensitivity. By calming inflammation, vitamin K contributes to better vascular health and stronger responses during intimacy. Food sources of vitamin K. There are two main types of vitamin K. Vitamin K1, phylloquinone, found mainly in green leafy vegetables, like spinach, kale, collard greens, and broccoli. Vitamin K2, menaquinone, found in fermented foods like natto, cheese, and certain meats such as liver. For elderly men, a balanced intake of both K1 and K2 is important. K1 keeps the blood clotting system healthy, while K2 is more active in reducing arterial calcification and supporting cardiovascular health. Including a variety of these foods in the diet ensures broader coverage of vitamin K's benefits. If you're on blood-thinning medication, such as warfarin, you must consult your doctor before increasing vitamin K intake. This vitamin interacts directly with such medications, and adjustments may be necessary. For most men, however, getting vitamin K through food is safe and beneficial. Supplements should only be considered under professional guidance. Erectile dysfunction in older men is rarely caused by a single factor, but improving blood flow is always at the heart of any solution. Vitamin K provides a natural way to keep arteries flexible, reduce calcification, and improve circulation where it matters most. When combined with other lifestyle practices, such as regular exercise, balanced nutrition, and stress management, vitamin K can become an important piece of the puzzle for restoring vitality and intimacy. As we reach the end of this series, it becomes clear that true recovery from erectile dysfunction is not about quick fixes or risky shortcuts. Instead, it's about giving your body the nourishment it has been missing. Each of the 8 vitamins we explored, vitamin D, B12, C, E, B3, B9, A, and K, plays a unique role, yet they all work together to restore balance, improve blood circulation, protect nerve function, and support hormone health. Think of it as building a strong foundation. Vitamin D ensures proper hormone regulation. B12 and folate B9 protect nerves and blood vessels. Vitamin C strengthens arteries and boosts nitric oxide. Vitamin E defends against oxidative stress, while niacin B3 improves blood flow directly. Vitamin A supports testosterone, and vitamin K keeps calcium in check, preventing blockages in your arteries. When combined with a healthy diet, regular exercise, quality sleep, and stress management, these vitamins can become powerful allies in your journey toward recovery. They do not work overnight, but with consistency, they can help restore natural function and confidence. The key takeaway is this: erectile dysfunction can often be improved when we focus on the root causes: poor circulation, nutritional deficiencies, and oxidative stress. By supporting your body with the right vitamins, you give yourself the best chance for long-term vitality, energy, and a healthier intimate life. Your health is in your hands, nourish it wisely. If you found this video helpful, please like, share, and subscribe for more health tips designed especially for seniors. Your support helps us create more content that empowers you to live stronger, healthier, and happier at every age. Important note: this video is for educational purposes only. It is not medical advice. Always consult your healthcare provider before making changes to your diet, supplements, or lifestyle. Thanks for watching.